Good morning, everyone. I apologize for the short delay here. We had a little bit of technical difficulties, but I think we are ready to roll here. So good morning, everyone, and thank you for joining us for this educational program. All participant lines have been muted to ensure the audio quality and provide a distraction-free learning environment. At the end of the presentation, we will allow for a live short Q&A. Sorry about that. But you can use the comment section to send questions, and we will address as many questions as time allows at the end of each presentation. But at the end of this program, we will send you an evaluation. We ask that you please give us feedback to ensure that we have the best, we serve you the best, our lupus community the best, to engage with you in future programming. This first session of the Navigating the Pediatric Lupus Journey is a wonderful presentation. It's actually a 4-part series. Each session attended, the pediatric patient will earn a reward. A $5 e-gift card will be awarded for each session. At the completion of the webinar series, any rewards earned will be distributed to the pediatric patient. After the completion of all 4 sessions, the pediatric patient will receive an electronic gift card and a certificate of completion. I'd like to take a moment to give a brief disclaimer. The Lupus Foundation of America Greater Ohio chapter does not give medical advice to patients regarding their lupus treatment. Your physician is the best source of information regarding the medical management of your lupus. This program is available for informational and educational purposes only. The content provided by other providers and/or professionals within the context of this program is not necessarily the opinion of the Lupus Foundation of America. So we can now begin our program, the Navigating the Pediatric Lupus Journey. Thank you guys again for joining. My name is Leslie Viscara-Tierney. I've been dedicated to the mission for, over a decade now. And we really appreciate you guys joining us and taking the morning to learn more. We look forward to connecting with you in the near future in person. Projects are carefully being considered, and we are hopeful that we can gather together soon. For the time being, we look to the bright side of digital programming, so you can now learn from experts and professionals across the state of Ohio in the comfort of your own home. And today, our experts have created presentations specifically designed to help you understand lupus and provide best practices for managing a chronic illness. We have an excellent program for you guys this morning. But first, I'd like to take a moment to recognize our generous sponsor. Funding for this program has been made possible by GSK and Us in Lupus. We would not be able to host important programs like this without our sponsors, and we thank you, GSK and Us in Lupus, for their support. So getting this program started here, and just bear with me, you guys, as I transition slides, but our first speaker today is Dr. Hermine Brunner. Her topic today will be, what is lupus and how is it diagnosed? Dr. Brunner is a board-certified rheumatologist and is the Director of Rheumatology and a professor at the University of Cincinnati Department of Pediatrics. Our second tag team presenter is Dr. Jennifer Huggins. Her topic today will be what to expect after diagnosis. And they're really going to tag team this conversation that we're having. And we look forward to both the presentations. And excuse me, I should mention, Dr. Huggins is also a board-certified rheumatologist and the fellowship program director at the Division of Rheumatology and associate professor at the University of Cincinnati Department of Pediatrics. So just as a reminder, we will open up live Q&As. If you just use the comment section on your functions here, at the end of their presentation, I'll be able to open it up and read any questions that we might have to the presenters so that we can have a conversation and continue the discussion. But thank you both so much, Dr. Higgins and Dr. Brunner. Just give me one moment to transition your slides. Very good, Dr. Brunner and Dr. Huggins. You may have the virtual floor.
Okay, let me unmute myself. Thank you so much for that kind invitation and also introduction. And well, I'm delighted to be here this morning with Professor Huggins, one of my longtime colleagues. And we will share the topic, what is lupus, how to diagnose it, and what to expect in the lupus journey. The latter part we will manage by, expecting your questions, and hopefully we can answer them to your satisfaction. Next slide, please. So what is lupus? Lupus is a chronic disease that occurs when your body and its immune system attacks its own tissues and organs. So when the immune system becomes active and encounters something like a virus, it reacts by creating inflammation. And with lupus, the inflammatory response is very brisk and unfortunately, many persons with lupus immune system is set in a way that it's kind of more set towards inflammation. As your pediatric rheumatologist probably told you, as of now, we do not have a cure for lupus, so it's a lifelong or chronic disease, although we're all aware that the Lupus Foundation is really fighting to find a cure for lupus. Next slide, please. So the immune system is quite a new part of the body, and that might be one of the reasons why it doesn't work perfectly. So, and the main job of the immune system is to fight off infections like viruses and bacteria or other critters that come into our body. As you know from the most recent COVID pandemic, the immune system is far from perfect because otherwise none of us would ever have gotten sick. And another part of the immune system is to get rid of old and faulty cells. And with lupus, there is patients who have been diagnosed with lupus have been found to have some problems getting rid of these old and faulty cells, and that by itself is a driver of inflammation. Now let's look to the right side of the slides and let's look where the immune system sits and what is it. The immune system consists of many cells and they sit in the adenoid glands, in the tonsils, in the thymus, which is a little gland that sits on top of your heart, and in the lymph nodes. The part of the immune system is also sitting in the spleen, inside your bones, and an important part is the lymph nodes. So people who don't have lymph nodes, they have a lot of problems with their immune system, but that's not, immune deficiency is not really a main problem with lupus. So what does the immune system? It consists of many different cells, and there is a specific type of cells, the white blood cells, and a subtype of this white blood cells is called B cells, and they produce antibodies. And you have heard everything about antibodies. And antibodies, they look like Y-shaped proteins, and when a person gets vaccinated, they make antibodies against, the protein that we're vaccinated with. And so the antibodies, they neutralize the threat that comes to the human body, but unfortunately with lupus, the body also makes antibodies that attack the organs, and that causes part of the problems person with lupus experience. Next slide. So, as I alluded to, the immune system sits in many different parts of the body, and it's quite complex, and it's far from being perfect. One very typical feature of lupus is that the person's body makes antibodies, these Y-shaped proteins, towards the nucleus of a cell, and that's shown on the right side of the slide. That's the blue part, and it also kind of makes sometimes antibodies to other parts that are swimming inside the cells. So with lupus, the body by mistake recognizes a person's own organs or other parts of the body as foreign, although they're part of the organism and they should not be attacked. Next slide. You might have heard there are different types of lupus, and most persons who are diagnosed with lupus early in life will have systemic lupus erythematosus. That means that make these antinuclear antibodies, these Y-shaped proteins, and different parts of the body is affected. And Dr. Huggins is gonna tell you more about that. There's also a form that's quite common among adults. It's called cutaneous lupus, and that means that mostly the skin is involved. And as your lupus doctor probably told you, sun exposure is like a trigger for getting the inflammation going with lupus, and that is because then the skin gets burnt and the nucleus of the cells basically spills out into the blood, and that drives the antibody production. There's also a rare subtype called drug-induced lupus, and also neonatal lupus, and which is very, very rare and happens to some women who have Rho and La antibodies, but that is not the topic of today's session. Next slide, please. So lupus is one of the most complex diseases because it actually can affect almost every part of the body. Most commonly affects the skin and the hair, so it makes your skin more photosensitive. It can, and also the another common involvement site is the muscles and the bones. What is the involvement that's most serious to be taken is involvement of the brain or the kidneys, and Dr. Huggins is going to tell you more about that. Because lupus can have so many different features, it's sometimes hard to diagnose right away, and there is not one sign or symptom a person with lupus experiences that would let the doctor know that is lupus, it couldn't be anything else. And that's why lupus is sometimes called the disease of 1,000 faces. New slide, or next slide. So why do some people get lupus and the others do not get lupus? Well, we do know that about a third of the predisposition for getting lupus comes from the genes, and the genes are the information that's passed on from the parents to the child. But we also know that the environment and environmental factors can contribute to the clinical manifestations of lupus. And there's also some immune dysregulation that occurs after a person gets born. So as of now, all the genetic studies that have been done in lupus cannot explain more than about a third of a person's risk for lupus. But we do know that persons who are diagnosed with lupus early in life, they very, very often have another family member who has been diagnosed with lupus or suffers from it. Next slide. So let me sum up. Lupus is a disease that causes chronic inflammation and where the immune system attacks the body's own tissue. About 90% of the patients who have lupus are female, and that's part of this genetic predisposition I mentioned earlier. Children with lupus, about 20% of persons who are diagnosed with lupus are diagnosed during childhood, meaning prior to the age of 18 years. And we do know another sign of the genetic predisposition that African American and Hispanic persons are more likely to get lupus compared to others. At this time, I would like to hand over to Dr. Huggins. Next slide, please.
Well, good morning, everyone. Just going to dovetail on the great presentation by Dr. Brunner. So next slide, please. So hopefully not, but more than likely, many of you on the webinar today had some challenges with getting diagnosed with lupus. And that has to do with, I tell people on a regular basis that as physicians, we go to school for a lot of years to realize we don't know that much. And Like Dr. Brunner pointed out, the signs and symptoms of lupus, they're very different person to person. They also in the same person can change over time. And many of the signs and symptoms of lupus, they overlap with other diseases. So it's very prudent for your physician to make sure they're not, not missing something else, especially because there's really no one test that helps us diagnose lupus. Next slide, please. So probably many of you on the call are way too young for Dr. House, but I always tell the trainees that are with me to be like Dr. House, and anytime you have a complicated case, you can say it always could be lupus, because that's what he would say in his TV show. And the diagnosis of lupus is really made based on accumulation of results from blood and urine tests, what's happening in the person, their signs and symptoms, and then also what you see on physical exam. Next slide, please. So the American College of Rheumatology partnered with the European League Against Rheumatism, and they have come up with revised in 2019. Dr. Brunner was part of this group. Criteria for lupus. So these are things that at least enable similar people to be included in research studies, but there are times where the diagnosis of lupus will be given where they don't necessarily meet these classification criteria. But in general, they dovetail. So next slide, please. So this is a complicated slide, but this is actually the criteria that they produced to make the diagnosis of lupus. And each of these manifestations of lupus are given a certain point system. At the start, you need this blood test that Dr. Brunner alluded to, the ANA. You need that to be positive at a titer of 1:80, and I'm going to explain a little bit more about what that means. And then we'll go through what each of these manifestations look like. We won't go through each of the point systems, but all total, you need to have more than 10 points to be classified as having lupus. All right, next slide, please. And I apologize, but I have a cat hanging from my blind, so I'm going to quickly get him out of it. That's the downside of being at home doing this. I'll be right back. He's very naughty, but he was going to break the blinds. So anyway, so this is the Y-shaped protein that Dr. Brunner alluded to attached to a cell. These are the antibodies. And again, like Dr. Brunner said, you've heard a lot about antibodies because of COVID antibodies, but these are antibodies that are actually in lupus patients. These are proteins of your own that for some reason recognize parts of your own body as foreign, and they start to attack them. And not to get too technical, but next slide, please. And it's not necessary that you understand this, but just in case you had questions, what does this test actually mean? They take these, what are called HEP2 cells, because they have big nuclei, and the nuclei are those red dots in the middle of the cell. And then the Y-shaped proteins that you see there are in your blood. So they look to see if you have any of those Y-shaped proteins that will attack the nucleus of your cell. And then the way they detect it is they label it with this fluorescent dye where they can actually see it under the microscope. And they keep diluting your blood until they don't see it anymore. That's how you get this titer. And so this test has to be positive in order to make the diagnosis of lupus. Next slide, please. Then once you have that test positive, there are all these other manifestations that I showed you in the first slide. So a fever gets you several points. But fever is not a very common manifestation of lupus, but if present, that counts. Then they look at all the different types of cells that you have in your blood. So the leukopenia means your white blood cells. The thrombocytopenia means your platelets. And then the last one, autoimmune hemolysis, that means that those proteins are attacking your red blood cells and making you anemic. So you can have fever plus any of these other manifestations in your blood. Next slide. Then, as Dr. Brunner alluded to, unfortunately, sometimes these proteins are attacking parts of your brain. And there are basically 19 different ways that your nervous system can get involved in lupus. But the ones that give you points in terms of the diagnosis are these three, which is that you have delirium, which is just an altered mental status, psychosis, which I think most of you would know what that means, or a seizure disorder. Those are the manifestations that would get you points for the classification criteria. But there are many other ways that the brain can get involved, and Dr. Brunner has devoted a lot of her research career to trying to understand these manifestations a lot better. So you can get neuropsychiatric lupus without having one of these three. There are other ways, but these are the three that count for the classification criteria. Next slide, please. And then there's multiple ways that your skin and your mucus and your mucosa in your mouth or your nose can be involved. So rather than read through this slide, I'm just going to show you pictures of each of these different ways. So next slide, please. So first, many of you might be familiar with what's called the malar rash or a butterfly rash. It gets worse in the sun. It usually involves both cheeks, and it has variable involvement on the bridge of your nose. So usually we say that it spares the bridge. People sometimes think that that's because your nose protects that part of your skin from the sun, and so you're less likely to have that part involved when you have this malar rash. Next slide, please. And then you can have this discoid rash. Again, in adults, you can have just the discoid lupus and not have systemic lupus. But as Dr. Brunner alluded to, if you have this discoid rash in pediatrics, you usually have the systemic lupus. And discoid means that it's like it scales easy. You can see that it has sort of irregular round borders. And this can lead to scarring. Next slide, please. And then you can get mouth sores or sores in your nose. This is fairly common, and we, with each exam, really look to make sure that this isn't happening to a patient. Sometimes this can be an early manifestation that the lupus is flaring up. Certainly, many people get mouth sores that don't have lupus, but when we know the person has lupus, we're certainly on the lookout for these manifestations. Next slide, please. And then people with lupus are very sensitive to the sun. The sun can flare their disease. So even without a rash, the sun can make you sick. But it can also give you various rashes that occur only primarily when you're in the sun. Next slide, please. And then itis always means inflammation. As Dr. Brunner said, lupus, the inflammation is happening in a way that isn't healthy for you, and it can affect every organ in our body has a lining around it, and that's called the serosa. So serositis means inflammation in the lining around your organs. And most frequently, you can have inflammation, as the chest x-ray on the left shows, inflammation around the lung. So on the right side of the chest, it's actually your left part of your chest, but where it looks very gray, that's normal lung. Every place where it looks very white, there's fluid there that shouldn't be there, and it's undoubtedly making it very difficult for this person to breathe. You can also have this inflammation and fluid collected around the heart. So the right diagram is actually a CAT scan. And where you see it says pericardial effusion or EFF, that means where it's pointing to, that gray area is fluid around the heart that is making it very difficult for the heart to pump. And then also you can see left pleural and right pleural EFF, that means effusions. So there's also in this person's chest fluid around the lung where it doesn't, and that's all due to inflammation. Next slide, please. And then you can get arthritis or inflammation in the muscle, as Dr. Brunner showed. And this is just an example of some arthritis in the hands and x-rays that demonstrate that as well. Next slide, please. So unfortunately, the kidney can be involved in lupus on a pretty frequent basis, such so that every time we see a lupus patient in our clinic, we get a urine sample, because that can be the first clue that that you have inflammation in your kidney. So the first thing is manifestation is if you have too much protein in your urine. That's the first part of this. But then after that, to make the diagnosis, and unfortunately, probably many of you on the call have had this done, but we need a piece of the kidney to look at under the microscope, because then the kidney involvement gets classified as on 1 through 6 classification, and that has ultimately manifestations in what we advise for treatment. Usually the biopsy is done with guidance from ultrasound and radiology, and the left thing just sort of depicts where they go with the biopsy. Next slide, please. And then lastly is some blood tests that we can do to measure some of the abnormalities that are happening in your immune system that Dr. Brunner talked about. So the first is you can make proteins that make you are more likely to clot, and those are the antiphospholipid antibodies. So those are blood tests that we can measure to see if you have too much ability to clot. Then some of the genetic abnormalities occur in these proteins that are called C3 or C4. So many people with lupus have a deficiency, an inherited deficiency in these proteins, and that makes you not alone get lupus, but makes you more susceptible to lupus. The other thing is these proteins are proteins, the C3 and C4 are proteins that help us fight infections. So if we have pneumonia or something like that, it's usually high. But in lupus patients, especially when the lupus is active, these proteins go low because they're being used to attack your own body. So they are things that we measure on a regular basis, not just to make the diagnosis, but once you have it, to assess how active is your lupus. And then there are two other specific antibodies, or these Y proteins, that are very specific for lupus. One of those is called anti-double-stranded DNA, and the other is called anti-Smith. And those don't need to make any sense to you, but these are just other immune proteins that are abnormal in patients with lupus. And actually, these are very specific to lupus. So if you have these proteins, you very, very likely have lupus. And then the last slide, please. So I think many of you are aware that this terrible disease doesn't spare anybody. So there are many famous people, celebrities, including yourselves, that that have lupus. And hopefully everybody's working hard to, as Dr. Brunner has devoted her life to research with lupus, to figuring out how to, if not cure this, at least better manage it. And that's why we're very appreciative of the Lupus Foundation. And I think now Dr. Brunner and I would just like to open it up and to answer questions like, because soon you'll have a talk about how to manage lupus. So maybe questions that you have about what we presented, or questions about once you have the diagnosis, what you should expect, then we're happy to answer those questions at this time.
So great. I have a few questions did roll in. Thank you very much, Dr. Huggins. And actually, you have a little fan following here. You have a former patient joining us. This patient was diagnosed 13 years ago and is happy to hear you speak and is still around the Lupus Foundation and joining you again. So that's really nice to see. I appreciate that comment. And if you would please just use the comment box to submit any questions. I'd be happy to facilitate any questions that pop up. And as questions roll in, just one of the questions I would like to kind of address here is, first and foremost, we put together this program because it came to our attention that there was difficulty in some pediatric departments where patients they're finding patients being non-compliant with treatment and medication, and a possible disconnect between communication. And so we wanted to open the lines here to these expert physicians, the time to talk with patients and open that line to hopefully bridge that gap and have this conversation. So that is something very alarming to us. And one of the questions that we wanted to know is, what can a lupus patient, a pediatric patient and their family really expect after diagnosis? Could either of you touch upon that while questions roll in?
I can do that. So maybe you mentioned compliance to treatment and initially, so maybe that, I hear a little bit of an echo, but maybe that leads over. So persons who are diagnosed with lupus, they are asked to take at least one medication, and that's hydroxychloroquine. It's almost like a medication that helps to dampen this inflammation with lupus. And in my practice, I call it a vitamin for persons with lupus. So you don't get the wow effect like with stronger medication. But if you take it and you take it regularly at the prescribed dose, then it prevents lupus from getting into other parts of your body than as it mostly is the case in the skin and in the joints. And it also prevents that lupus gonna scar the body and causes damage. So it's very important to try the hydroxychloroquine, even if you don't feel that much different, like as you would with a supplement or a vitamin the next day. So persons who are diagnosed with lupus need to really engage and be an active part of the treatment team. Because it's a chronic disease, you need to talk and work with your doctor to make sure that the medication that are prescribed, that you can have access to them, that you tolerate them. And you need to tell the doctors if you have problems taking all the medication that were prescribed. The different ways to treat lupus. But I think the most important part is if you kind of find yourself in difficulties, following the treatment plan, that you let us know. And at least at Cincinnati Children's, we have a pharmacist and we have some social worker and we have some other programs that can support a patient and families to help them manage all the medications that are sometimes needed to treat the inflammation with lupus. Jennifer, I don't know whether you want to add anything else to that.
Yeah, I mean, I think sometimes at night when I'm taking a shower, I'm like, oh, I don't know if I can do all that I just asked those people to do today. So I think when you first get diagnosed, first of all, there's probably more tests because we're trying to figure out every part of your body that might be affected by the lupus. So that the tests alone can be overwhelming. And then the better outcome of your lupus is depending upon what parts of your body are involved and how much is involved. It does include an overwhelming number of medications. Sometimes if you don't have much involved and we are able to find it early, then it's not the case. But otherwise, the truth is that the more aggressive that we are in getting it under control in the beginning, then the better your outcome, and ultimately sometimes the less amount of medication that you need long term. But I think what you need to one of the things to expect is that it's just incredibly overwhelming and that you need a village. So you need a huge support system. And like Dr. Brunner said, you know, in part because she's our division director, we have a lot of support for people, but the Lupus Foundation, while they don't give medical advice, they also can help provide some of that support in your own family and friends. And, you know, we're also always available, you know, just to help you get on the right path. You can certainly, we work with people all over the country, you know, just giving a second look, or, you know, you can reach out to us and we can try to help you. But again, if you're feeling overwhelmed when you first got diagnosed, that's a normal, healthy feeling, I think.
One of the questions that are coming through, you know, you spent some time talking about the importance of medication and giving it some time if you're prescribed the hydroxychloroquine or Plaquenil, and letting that build in the immune system, and you made mention to that. A question that rolled in is, will I be on these medications my whole life?
Certainly I always tell the lupus patients, Plaquenil is your friend. So as long as you don't have any side effects from the Plaquenil, but that is, so there's only a couple things, because no secret that I'm old, but two things have changed that have really revolutionized the care of people with lupus. One is that we understand the importance in how Plaquenil works, and how once we get the disease under control, Plaquenil can keep it from flaring back up. And the other is that we see you on a regular basis. So you can expect a lot of doctor's appointments, but we used to tell people with lupus, once things were stable, come back when you don't feel well, and they would come back with, you know, rip-roaring kidney disease or something like that. So now we know that we need to see you even once things are stable every 3 or 4 months, and we assess all these things for early manifestations of a flare. So that other medications, once it gets under control, sometimes they, you know, of course, the dreaded steroids, so it's always our goal to get you off of those. But Plaquenil is safe during pregnancy. It's not only safe during pregnancy, it's important for healthy pregnancies and so forth. So unless you're having some side effects from the Plaquenil, you can expect to be on that for forever until someone finds a cure, which maybe will happen.
Along those lines, we have a lot of new medications. Some of them were recently approved for the treatment of lupus, and they seem to kind of burn out the lupus inflammation. And so one of them is, you may have heard, is belimumab or Benlysta, and that is especially helpful for persons who have low complements, and Dr. Huggins introduced that, and also those who have a lot of these antibodies, these Y-shaped proteins. And if you have, you know, severe or moderate organ involvement, that might be a medication that helps you. There are also other medications we call immunosuppressants that helps us to avoid steroids, and we sometimes start those just to get rid of the steroids or make you not have to take them to protect your body, because we do know that if one takes higher doses of steroids for a longer time, that you will get damage to your body just from the steroids.
I have a two-part question here. One is, looking at symptoms, what do I need to look out for if I'm in a flare, and will I eventually grow out of my symptoms? Two-part question there. So what are the symptoms I need to look out for if I'm in a lupus flare?
We talked about lupus being a disease of 1,000 faces, and every patient has a little bit their own pattern, but I'm confident that your lupus doctor will tell you about the things you need to look out for. So if, for instance, some persons with lupus get a skin rash, that'll be a sign. Overwhelming fatigue would be another sign. People are more joint pains. So those who have kidney involvement, for them, it might be a little bit harder to figure out whether they have a flare. But you know, that is the reason why you need to see your lupus doctor regularly, because sometimes we need to do blood and urine tests to find out whether your lupus is more active. So your lupus may be more active and you may not even feel it. But if it's not treated promptly, then you will have damage from the ongoing inflammation with lupus.
So really reducing that inflammation is what patients should be looking out for. Interesting. So a question that appears in the chat box is, does a skin biopsy tell the difference between rosacea and discoid lupus?
It should. If it's analyzed properly, it should help. Sometimes we do get help from our dermatology friends, though. They can certainly help us tell the difference.
So I might butcher this question just a little bit. Do either of you have any information on anti-neuronal cell antibodies, and if it has indication, for psychiatric lupus? I apologize, the text is very small.
Okay, so anti-neuronal antibody, it's a fancy name for these Y-shaped proteins that attach part of the cells that are inside the brain or other parts of the nervous system, like the nerve fibers. In order for these proteins, these anti-neuronal antibodies, to attack the brain, they need to get into the brain. There is more and more evidence that high levels of anti-neuronal antibody, even in the serum, constitutes a risk factor for getting neuropsychiatric lupus. So if one tests for these anti-neuronal antibodies in the blood, there is not such a strong correlation or association with neuropsychiatric lupus, but it would make a physician look more closely whether there is brain involvement. How would looking more closely, what does it mean? There may be an MRI. There may be that you get special testing of the thinking and remembering called neurocognitive testing done, just to see how well your brain, the brain is functioning.
And I have seen those antibodies, right, even if they're not affecting your nervous system, they can be elevated if your lupus is active in general. So you can still maintain those if it's at a lower level, but if they're rising, then they can be of significance, even if it's not that they're affecting the brain. But
We have some smart patients out there really investigating her, so that was a great question. Thank you for submitting that. And quite a few people saying, I'm learning a lot. Thank you for hosting this and taking the time to speak with us. I believe this possibly is, are there medical researchers finding a solution for lupus?
Oh, there's a lot of research going on. And I think we made a lot of progress over the preceding years. You know, just think about it. And the Lupus Foundation was a big part of that. 2 new medications that have been approved for adults with lupus, 1 for children with lupus already, and probably the second one is soon to come. So increased understanding in the disease processes really helps us provide or make better suggestions or choices for treatment. We also learned, you know, the different mechanisms, how the body's immune system exactly attacks the different parts of the bodies with lupus, and that also helps us to find better treatments. And also lab tests for figuring out whether there is.
But so I do think there's certainly in my lifetime in medicine, there's been dramatic improvement for the care of people with lupus and the availability of things to help you have a better quality of life. The same difficulties that are there for making a diagnosis of lupus also make it hard to research, which is why there are these classification criteria. So you're trying to at least compare apples to apples, but you know, it's not the same genetic problem. It's not the same environmental problem. There's a lot. It's just very complex, just like it is to try to diagnose. But huge inroads have been made, and so I think it's safe to be optimistic that at a minimum there will be continued improvement in the care of people with lupus, and hopefully someday a cure. And certainly Dr. Brunner has devoted her life to life in medicine to figuring this out. So
I can contest there's a lot of research happening right now, and I know the Lupus Foundation stands behind and pushes efforts to get proper funding for research happening. So that's something very important to all of us. I'm going to follow up with just this last question here. It has to do with vaccinations and triggers to lupus, and I think that's probably a hot topic. And I just wanted to make mention we are devoting one full session to infection and COVID and vaccines at our next pediatric session. Dr. Buchmazel, who is leading research here in Cleveland, is doing some research on that. So, but I would like to ask this panel as well, because it did come in. Can vaccinations trigger lupus? And are you recommending the COVID vaccine for all lupus patients? Big question.
Jennifer, can you take that? That's your...
So people with lupus, just by nature of their disease, are more susceptible to certain infections, like ones with pneumonia, meningitis. So we have a big campaign in our clinic to make sure that we protect all of our lupus patients with vaccines for the organisms that they're more susceptible to just because they have lupus. In addition, I think I was even having this discussion with some of my tennis buddies the other day, but what people don't know as well is that many of our vaccines, like hepatitis B, Gardasil, those prevent against cancer. And unfortunately, lupus patients are more susceptible to cancer as well, just because of what goes awry in their immune system. And then on top of that, for sure, the COVID vaccine is very important too, because most people with lupus, just at baseline of having lupus, are immunocompromised. And then on top of that, you're probably all on some medications. So there are reports of people's disease flaring with the vaccine, but those are few and far between, and also sometimes difficult to make the connection. But the vaccines for lupus patients are really crucial to prevent against infections, but also to prevent against cancer. So that, I hope that.
And for sure, that wouldn't cause lupus. So there's not a vaccination that causes lupus that is approved.
It's not a trigger. And definitely, that is definitely a question you want to work with your rheumatologist and talking with them if there's any concerns about, your children's vaccinations and things like that. I think that's a good segue into our next presenter. I really appreciate this talk, and we have a lot of great comments congratulating the chapter and thanking the physicians for taking the time speaking with us today. But thank you. I enjoyed our Q&A session. That was lovely, and the presentation. And so I'm just going to transition over here. And hi, Courtney. I see you turned on your camera. If you could
I fixed my camera issue.
Very good. No, you look great. If you could just give me 1 second, I'm going to go ahead and give you presenter here, if I can do that. One moment, Courtney. And I'll just have a little intro here for you. Our final presenter is Courtney Mitchell, BSN, MSN, CFNP. She is a patient engagement liaison with GSK. She has extensive experience working with the lupus community and has a passion to help empower and advocate for the lupus community. We have the pleasure of having Courtney present on managing your lupus here today. And I want to thank you, Courtney, for joining us. And just give me 1 second, as I know you're probably pulling up your screen too, and I just give you control. I just want to thank you for joining us and our doctors this morning to present. And I see your screen very beautifully, and it is in a perfect mode.
All right. Hang on. I'm not seeing it on my screen, so hold up 1 second. Okay, can you see just my presentation slide, Leslie.
Just your presentation slide, yes. It's perfect.
Okay, just making sure we are good to go. Okay, great. Thank you all so much for having me, Leslie. I'm super excited to be here today. And Dr. Brunner and Dr. Huggins did some great presentations. So that was awesome. In fact, they even touched on some information that I'm going to share today about managing your lupus. So just as a disclaimer, just make sure that you know that this does not take the place of any of your medical advice that you get from your providers. But this really is geared to talk about, how you can manage your lupus. Dr. Huggins and Dr. Brunner talked a lot about diagnosing and treatment from a clinical standpoint, but this is really going to be a lot about lifestyle change, which to me is just as important as making sure that you take your medicines and then make sure you follow your doctor's advice. So really that's going to be what this is geared on. And Leslie, thank you for the sweet introduction. So yes, I'm a nurse practitioner by trade, and I practiced rheumatology for 10 years. So I really have a heart for the lupus warrior. I have held hands and cried with you all and really have an understanding of your journey. So I have a true passion. So I really like to educate lupus warriors and, just help you understand your chronic disease, because I know that the journey is very, very difficult. So I've been supporting lupus patients for ultimately 17 years now through diagnosis, treatment, as well as, through GSK and patient advocacy. Today, a couple of things we're going to cover. We're really not going to touch on lupus education because Dr. Brunner and Dr. Huggins really did a fine job of that. But we're going to talk about symptom tracking. We're going to talk about communication, and then making sure you stick to your treatment plan. I know Dr. Brunner and Dr. Huggins really touched on adherence, making sure that you take your medications and that kind of thing. So we're going to really talk about that and how you can manage your symptoms to make your outcome better living with a chronic disease. So first of all, your role as a patient is to really be engaged in your care. Understand that you're the center of that care, right? You're the one that ultimately is the decision maker. You're going to I like to think of it as, you the patient, you're the center of your care, and then you have all these, factors around you. You've got your healthcare team, you've got your family, you've got your friends, you've got your support system. And I think the more that you know, I think that knowledge is power. So the more that you know is definitely going to create a better outcome for you. But being engaged is so important. Making sure that you actively manage your lupus symptoms, you collaborate with your healthcare team, definitely helps the process, and then helps definitely reduce the risk of flares and organ damage, which we know with lupus is definitely something to be cautious of and to help prevent the progression there of that organ damage. So what does it mean to be an engaged patient? I think that definitely the first step is educating yourself. Just like you're doing today, you're being part of this webinar. You're making sure that you know as much as you possibly can about lupus and lupus nephritis. The more you know about your chronic disease, I think that leverages you and puts you in a great position so that you can, number one, have an understanding, but number two, be able to communicate with your doctor and your healthcare team. As you know, lupus is a very, very complicated disease. So, like I said, education is power. The more that you know can definitely help you through your health journey. Being an engaged patient also means communicating with your healthcare team, making sure that you share information on the symptom that you have over a period of time, monitoring your symptoms, tracking your symptoms, writing those down, and we'll talk about that throughout the presentation. Also, taking ownership of your health. I mentioned before, being the center. And just know that, this is a conversation that you have with your healthcare team, and you're very much a part of the decision making there as you work through your disease. All right, so now let's take a minute to talk about symptom tracking. I think this is such an important piece of managing your disease. So as we talk about that, we're going to talk a lot about, what to actually track and that kind of thing as we go through this information. So tracking involves monitoring your disease activity so that you can go back and communicate changes to your healthcare team. Like I said, being able to have those conversations with your doctor is key. And not just your doctor, I keep saying your healthcare team, but also your loved ones, the people around you that care about you. Make sure you keep open communication with them as well. So just some things to take note of. Make note of your symptom frequency, how often you may have had that since your last visit. Obviously when you go to see your rheumatologist, there's going to be an amount of time between those visits. Hopefully you are stable enough that you're going 3 or 4 months between those visits, or you might still be early in your diagnosis and your doctor may be still trying to, get you stable or get you to a really good place. So you might still be going every 4 weeks, 6 weeks. But anyway, there's the time between those visits, and a lot can fall through the cracks in between that. You might forget that you had a certain symptom, or you may not realize that a certain symptom that you had might be related to your lupus, and that you might still actually be having active disease. And you may not know that that's something that you need to share with your rheumatologist. Or if you're seeing a nephrologist, cardiologist, or anyone in that puzzle that's helping you with your disease process. Make note of, like I said, the frequency of a symptom that you're having, the duration and the intensity. So that's really important to share. And then also, practice, talking about it or writing about it as well. And then what works for you? So what are you going to use for your symptom tracker? At the very end, I'm going to share a resource with you where you can go and download a free symptom tracker. But really, it's about you. What are you comfortable? Do you like just a regular notebook? Do you like to, jot and document? Or if you have a calendar that you like to use, just, write it down in there as well. And then, of course, the younger population, you guys like to use apps, and there's actually symptom tracking apps out there that you can find on your phone, and you can utilize those. But really, at the end of the day, find something that works for you, where you're really going to be prone to utilize this resource and, really make notes so that you can go back and have a great conversation with your doctor. So what is health journaling? It's a personal journal that's complete, detailed record of your health experience. So when you're journaling, make sure to keep track of a lot of information. Number one, I think it's so important to make a list of your medications. Make sure that you're taking those to every doctor's visit. Obviously with lupus, that you might be seeing, your rheumatologist, you might be seeing your a nephrologist, and then obviously each year you're going to have appointments with your primary care doctor as well for your routine yearly follow-ups, or at least I hope you're going for those. But make sure that you keep a list of your medications so you can share that with anyone in your healthcare team, right? Make sure that you document tests and procedures that you have and those results. And more than anything, make sure that you ask. Make sure that you ask your doctor or healthcare team, hey, look, what does this mean? I know that you did this test. What does this mean? What are you looking for? But I think it's really important to jot that down as well. In your notebook, definitely take note of your diagnosis journey, how, when you started having symptoms, and then when you were diagnosed, and then things that occur in between there, so that when you do see a new physician, you can explain that and you can have that conversation. We talked a minute ago about tracking those symptoms and making sure you jot those down. And then also triggers, keep in touch, just being in touch with yourself and knowing, what your triggers are. So obviously with lupus, there's lots of triggers. It could be stress, lack of sleep, sun exposure. And if you're really not sure what your triggers are, make sure that you jot those things down. So when you do have a flare, kind of think about the days, or the weeks before, and what you feel like could have caused those triggers. So that, obviously, if you know what your triggers are, it can help control that as much as you can, right? Just be a part of that. On the previous slide, it talked about, jotting down emotions. And I think that is a critical piece of living with a chronic disease. We know that there's a psychological component that leads to depression and that kind of things. And that, it's also, your relationships, right? So I think health journaling from an emotional perspective is really good. Really getting those thoughts out on paper, how you feel, sharing your emotions, and your frustrations with your chronic disease. They say that really expressive writing is a way of organizing your thoughts, right? It leads to reducing stress and definitely managing your disease. And then also too, there might be bits and pieces and parts of the expressive writing that you do want to share with your doctor as to, what's going on, how you're coping and dealing. So health journaling, how to, find a format that works for you. I mentioned that before. If you're just a, notebook person, great. If you want something cute and fancy, that's great too. Just whatever's going to keep you on track and motivate you to continue that. Just make it a part of your routine. Hey, I'm going to do this for 5 minutes a day or 3 minutes a day, or, but definitely want to go in and make sure that you document the important things like symptoms that you may have between your visits. And then also, making sure that you, are in touch with how is lupus impacting your life, the emotional piece of that. We've talked about that a little bit. So making sure that you communicate with your doctor. I've touched on that a few times, but that is so important, to make sure that you're sharing information with your healthcare team that is open and honest. I think a lot of times, you guys will go into the office and, you may not want to have that woe is me, or you may not want to share things that are negative that are going on, but it's so important to make sure that you share all that information with your healthcare team. And it might be a circumstance where, hey, I'm doing way better than I was three months ago, but you still might be having symptoms. And it's great to share that, make sure that your healthcare team knows, hey, I'm doing better than I was 3 months ago, but I'm still having this joint pain. I'm still having this swelling, or I still, having this symptom. So just make sure that you share all that information. We talked a minute ago about, tracking symptoms, but really this is really around being prepared for your visits, okay? Make sure that you bring your symptom tracker with you, get that ready, look at that maybe a night or two before your appointment, and you might want to highlight or circle things that you definitely want to share with your provider. Of course, when you go in and see your doctor, you may have only 15 minutes, 20 minutes, or 30 minutes to spend with he or she. So you definitely want to make the most of your appointment and highlight things that you definitely want to share. Think about your treatment goals, have a great conversation with your doctor around that. And then make sure too that you list any questions for your doctor before you go in. Make jot down 3 or 4 things that you want to address with he or she. But it's great to jot it down just so you can have a reminder. Because, you know, how many times do we leave a doctor's appointment and go, oh man, I completely forgot to ask about, you know, XYZ. So it's great just to take that with you. It's also good to take an appointment buddy with you. Take a sister or a parent or someone that you trust to go with you so that they can pick up on things that you may not pick up on. You know, a lot of times we go for appointments, we don't hear everything the way maybe somebody else might hear it or perceive it. So taking a buddy with you is great. And then also to think about the things that you want to say. And I know it kind of sounds silly, but you know, why don't you even practice what you're going to say during that appointment? And that's just leading up to the appointment. So now once you get to your appointment, make sure that you have your medication list with you and your journal with you and have things, you know, like I said, outlined that you definitely want to share. And then also be an active listener, you know, be engaged. You know, we talked about earlier in the presentation, being an engaged patient. That's a part of it, you know, actively listen, and you might want to jot down notes as well, or even repeat back, you know, hey doctor, you know, I'm really having trouble understanding this. Is this what, you know, is this what you're saying? That kind of thing. But more than anything, I want to encourage you to ask questions. If you do not know and you don't understand something, maybe it's a lab test or a result that you don't understand, make sure that you ask your provider, you know, what does that mean? And then if you have to jot it down in your notes, that's great as well. And then also to consider whether you want to seek a specialist or a second opinion. You know, you want to make sure that you are clicking with your doctor and that you're, you know, having really good conversations with he or she. And it's okay if you know, want to seek a second opinion. So Dr. Brunner and Dr. Huggins talked about adherence. You know, this is so important, you know, really sticking to your treatment plan. So what does adherence mean? It means staying on your course of treatment, okay? Making sure that you take your medication timely, not just, you know, make sure you're taking it every day or, you know, at the right time every day, what's recommended. Make sure you're, you know, adding that to your lifestyle, making sure that you're, if you are one of those people that forgets, you know, set a timer on your phone, but just put a reminder, do whatever you have to do just to make sure that you're adherent with your treatment plan. So obviously staying adherent can help improve treatment outcomes and reduce healthcare costs. So look at it from a good perspective, okay? You're taking your medicine every day, you're doing everything you're supposed to do. It's gonna cut down on your ER visits or your urgent care visits, or even extra visits to your doctor that are urgent, okay? Gonna cut down on those flares, that kind of thing. So not staying adherent can cause, you know, worsening of your condition. You know, we've talked about complications from long-term organ damage. So think of it from that perspective. And, you know, I think here, this is where I like to talk about how the disease waxes and wanes. You know, obviously with lupus, you have, you know, days that you're feeling great, okay? So you're thinking, you know, I don't think I need to take that medicine. I'm doing great. You know, you've had a stint of 6 months and you're doing great. Well, you're doing great because you're taking your medicine on time. So, you know, keep that in mind. You know, staying adherent is key, okay? Do not stop a medication until you and your doctor have a discussion. That is so important. So I cannot urge that enough. Now, as you're coordinating treatment plan, you know, we've talked a little bit about, you know, having a rheumatologist and you may have a nephrologist. You know, there's so many people that go into your treatment. So, you know, here it just lists your primary care doctor. You're going to see them once or twice a year for sure. Your cardiologist, you might be seeing a cardiologist. You might be seeing a therapist, your rheumatologist, obviously, and you may have already had a referral to a nephrologist. But, you know, with your healthcare journaling, make sure that you, in your medication list, that you share that with everybody on your team, right? So another little bit about non-adherence, right? So, you know, you're skipping a dose of medicine here or there, or you're extending time between dosages. Just don't do that. You know, make sure that you're having that discussion with your doctor. If something's really disagreeing with you or you're having a side effect, to a medication, make sure that you have that conversation with your healthcare team, okay? Some other tips about being adherent, really have a good understanding of that medication. Why are you taking that medication? Dr. Huggins and Dr. Brunner talked earlier about Plaquenil. I mean, it's just a staple. You're going to be taking that medication for years and years, unless you're having a side effect to that. So if you don't understand why you're taking it, have that conversation with your provider. Actively engage with your healthcare team about your treatment plan. Make sure yet again that you are taking those medications during scheduled dose. Set a reminder on your calendar as well, and then also involve others in your care. I think it's so good to have friends, a support system. You may have a really good friend that has lupus, or you might have made some networking buddies, throughout your journey. So definitely, talk about it with people that you trust so that they understand, what are you going through, what your journey looks like. So earlier I mentioned some great resources that we have. You can either visit our usandlupus.com website, or you can hover over these QR codes and go to the site and get a symptom tracking kit. All of these resources are free. They're at your fingertips. They're great resources for you to go to. Some information over what I went over today, really how to symptom track, and then actually the symptom tracker kit, as well as learning how to keep disease activity low, and then also understanding the financial impact of living with lupus. I know I talked earlier about, cutting down on ER visits and how non-adherence can lead to extra costs. So there's some tips, financial tips there with living with lupus. And then also, I don't have a slide here, but if you'll visit our gskplacehub.com, you can sign up for webinars that are free to add to your bank of knowledge. So I'm gonna leave this here for just a second. I'm gonna turn it back over to Leslie. If there's any questions, I'll be glad to answer those. But thank you all so much for having me.
The only thing is your QR codes aren't popping up. So I don't know if your screen is frozen on the one slide here, but we're not able to see those QR codes. And if that is a problem, I'd be happy to email that to our group in a follow-up email if you wanted.
One word, let me scroll through here and see if I can't get, did the other slides move?
It was just one slide. They're moving now.
You never saw any of my slides.
No, I'm sorry.
Oh no, I wish you would have told
I
me.
messaged you, but I didn't want to interrupt because I was following along pretty well.
Now,
but that was it. Go back to the QR codes there to give our audience a time to either join at the usandlupus.com, or if you take your phone out, if you're not on your phone, and you could hover over these QR codes of what Courtney was talking about.
I'm so sorry. I hate that y'all didn't see the slides. Oh my goodness.
We do have questions though rolling in here, Courtney. So I think everyone was following along really nicely. One of the things is I think it says here, I find it hard to make my child journal. Do you have any recommendations? And along with that, difficulty getting the child to journal is my child doesn't necessarily want to share their feelings with me. They feel, and maybe do you have any recommendations for encouraging journaling and chatting with your kids about their disease activity?
Yeah, so obviously teens and pediatrics, it's kind of hard, right? What I would recommend is just introducing it to them really slow, like, hey, just keep a track of your symptoms. They may not be up for really sharing emotions and that kind of thing. I think that as far as having a conversation with your kids, they're going to share what they want to share, right? And at their time. And as a parent, I think it's just really important to understand that. I would definitely invite them to open up, maybe ask questions. Hey, how are you feeling today? Anything that you want to share, or, anything that you want to document in your journal. But really, I think it's, everybody's different, right? What they want to share. And I think it's great to respect differences and not to force that. But definitely make it available. You might just want to buy a cute little journal and give it to your child and say, hey, look, feel free to use this and to journal feelings if you'd like. Or, really very important just to definitely document any kind of symptoms that you're having so that we can share that with your doctor the next time you go.
Yeah, I think that's really important, getting them a fun journal that they like to doodle in, and maybe like fun pens and stickers, and this is your let it out journal, and this is where you write it down. And if something comes up that they want to talk about with you or with the parent, or maybe it's a question they bring up with their provider, that's the time that you kind of look at it,
Yeah.
And let it, like, either this is a private journal for you, kiddo, or this is something we're going to share together, and kind of set those parameters there. But I love stickers.
Yeah, another thing too, I love to teach them that about the stickers, Leslie. But you might want to just make it very simple and give them a calendar and give them stickers and say, hey, this was a good day, or this was a bad day. And you can just put your sticker with your mood and that kind of thing. And if it was a bad day, you might want to just say, hey, just tell me why. Just jot something really quick as to why it was a bad day. Was it that you were hurting, or that kind of thing. But yeah, keeping it very simple, making it fun for them.
Yeah, make it fun.
Yeah.
So another one here is, do you have any recommendations for like counseling or long-term counseling services for children with lupus? Have you ever made recommendations for that?
Yeah, so really, I think counseling is a good component. I think, honestly, I'm one of those people, I think everybody in this world probably needs counseling, right? Whether it be, learn to communicate with a loved one, spouse, or whatever, or sharing your feelings, right? Definitely. And what I would do, I would recommend, if you're looking for a counselor for your pediatric patient, I think that going back to your rheumatologist and asking, like, hey, who would you recommend? Because there may be someone that they've recommended to other people before that they feel like is great with children. So I would take that back to your healthcare team, go back to your rheumatologist, and see who they would recommend for that referral. And then that way too, you can keep, everyone in the loop.
Yeah, Dr. Brunner, can you weigh in on?
Yes, following up on Courtney, there are special psychologists that are helping with families to take medication regularly and also to cope, educate them with strategy to help them cope with lupus as a disease. That's one avenue. And the other avenue is talking to your lupus doctor or about, and the social worker in clinic, about helping with interventions in school. Schools also have counselors, and the social workers can work very closely with the school to make sure that appropriate intervention are put in place so that life of a child with lupus is easier. I see Dr. Huggins may have another comment.
I think those are all great suggestions, but I do think that, it's good to involve our mental health people. Like Courtney said, we all can benefit from it, but it's very unfortunate if you're a child to have to deal with such a chronic illness, and learning how to maneuver is a good thing to learn from the get-go, and not the training that I have anyway. But I wholeheartedly support the whole team.
Question that's popping up here.
I think Dr. Brunner just mentioned this about, and then Dr. Huggins too. So something we have to think about with the pediatric population, as adults, we have with lupus warriors, there's missing work and that kind of thing. With children, they're missing school because of their flares and that kind of thing. And a lot of times too, there's some embarrassment that goes along with that. because they've missed school. They don't want to talk about it with their peers or their teachers. So that psychological component as well. And I think, you just mentioned, Dr. Huggins, about making sure that you talk to people within the schools, and there's certain accommodations for people with chronic diseases. So, and then I think that's important too, as far as a psychological, mental standpoint, having a counselor to work through those issues. As adults, we can handle things a lot better than the pediatric population. And, think about, do you remember in middle school how awkward life is? And, y'all remember those years of the awkwardness and maybe social anxieties, that kind of thing. So as we think about our pediatric population, definitely recommended, mental health services, I think is very, very important. And talking to the school system and that team as well, having conversations to just help ease students through that process.
So in light of school and school activities here, I believe a parent's asking, can I encourage sport plays involving my child in sport activities, even though they have lupus?
Yes, it has been shown that participating in sports actually improves prognosis. What we wouldn't want is being out in the sun and getting sunburned out there, because, as you said in the beginning, excessive exposure to sun rays really can trigger a lupus flare. But we want children to be physically active. Having, if one is not active, then there's going to be weight gain, and that adds to the cardiovascular risk with lupus. What can be done is talking to the social worker to make sure that the appropriate intervention in schools are put in place. Like on a bad day, that the patient with lupus has the option to sit out gym or kind of self-pace. But in general, they should not be separated and ostracized and not be able to participate what the other kids are doing.
That's great. I know sometimes we want to protect our kiddos and maybe discourage it, but sun protection and wearing sun protective clothes can definitely help if they're out in the elements. Thank you. So we are wrapping up. I know we started just a little bit late, and I'm just trying to see if any other questions are coming in. We have a lot of well wishes, and some people saying they feel lonely, they wish we could join in together, and I feel soon enough we'll be able to come down to Cincinnati and head around to be with you guys again soon. But I see a lot of well wishes, and so thank you, Courtney, for your presentation on helping us manage lupus and that. And I do apologize about the screen share. A question that came up is, am I able to access these slides anywhere? Are we able to share those slides?
Actually, no. So yeah, Leslie and I have talked about that, is because we're, GSK and sharing those, we cannot. And I apologize too that it was frozen. So working on my end.
This presentation is being recorded, and we could talk about maybe sharing this video again if anyone wanted to watch it. And when it becomes available, I'll be sure to message our group that has attended today. So thank you, Courtney, so much.
Thank you. It was a pleasure being here with you all.
So I do want to help us just kind of wrap up and, again, thank our generous sponsors for helping us with this program. Funding for this program was made possible by GSK and us and Lupus, and we could not host these important programs without the support of them. So thank you so much for your continued support, GSK and us and Lupus. But I wanted to make mention to our second session coming up August 20th, the second part to the Navigating Our Pediatric Lupus Journey. Again, we will be covering lupus and infection. And I know covering in there will be a bit of talk about vaccines and COVID. And this is definitely a hot topic, and I encourage you all to join with us that next session. And again, it'll be similar to the parameters that we've had today. Dr. Buch-Mazel from Metro Health Hospital here in Cleveland will be presenting, and we are excited to have her as well for the next session. And if you have not yet registered, you can go to lupusgreaterohio.org or take your smartphone out and hover over that QR code to take you right to the registration page. But I do believe the majority of people that are registered here today will be prompted or has already registered for the full program. And I'm just making sure we're just a little bit over on time, and I do apologize for stopping late, but this does bring us to the close of our first session to navigating the pediatric lupus journey. Thank you everyone for joining us. We are tremendously grateful to our expert panel that have joined today to help create a path to empowerment. Please remember to complete the evaluations that we will be sending out. It'll be sent to you about 1 hour after this program, or after you exit out of this program, a pop-up will appear that you could take that evaluation for us. Just as a reminder, each session that you register for, attend, and submit an evaluation, the pediatric patient will earn a reward. A $5 e-gift card, Target e-gift card, will be awarded for each session, and at the completion of the webinar series, any rewards earned will be distributed to the pediatric patient. After the completion of all 4 sessions, the pediatric patient will receive that gift card and a certificate of completion. But please be sure to check our website periodically, lupusgreaterohio.org, or sign up for our emails to keep updated with information on services, program, fundraising opportunities. And by all means, you can give the office a call at 1-888-NO-LUPUS for more information, or we can contact you with a local patient navigator. We are committed to providing you with the most accurate information as it becomes available. And we do hope that you all continue to be safe and to continue to strive to find optimal health. And so we hope to see you guys here soon in the future. And again, thank you for joining us. Thank you all, and thank you, Dr. Brunner, Dr. Huggins, and Courtney for joining us. It was a great session, and I hope to get some great feedback, and I'll share that with all of you. So take care. Have a great rest of the day.
You
Have a great weekend.
Good weekend.